Hi, Mr. Lucas. I'm so glad you were able to come in with us today. If you can have a seat, definitely like to go ahead and discuss what we found, the results of your biopsy. Um, First, like to just kind of see where you are in your pain level. Are you feeling any kind of pain? Is it getting better? Okay, it's not getting any better. Okay, so what we found on the biopsy results, Mr. Lucas, is that you have what is called uh, squamous cell carcinoma, which is a form of a skin cancer. And I know you hear the word cancer and kind of think, is this life threatening? And that's kind of some of the things that I want to go over with you today to kind of ease your mind. You are in the early stages of squamous cell carcinoma, which is a really good thing because we are able to give you some things to some really good things to be able to get it under and manage it and get it under control. um, some of the things, a few of the treatment options. There are several treatment options for this condition. I do want to discuss a few that I think that we ought to try to start with, being that we're in the early stages. First, starting what is called the chemotherapy cream. This cream contains a chemotherapy drug, and it's really good to use for the early stages. Of course, this is kind of like a trial and error. So if it's something that's not working for you, we do have what is called a laser treatment. The laser treatments can be used to remove any of the squamous cell carcinoma that sits on the surface of the skin. So it's also something that is recommended during the early stages. And also another treatment option will be the photodynamic therapy. This treatment uses light to remove some very early skin cancers, and squamous cell carcinoma is one of them. The more aggressive treatment options will be surgery, and that is something at this point we may not want to get into. I would definitely suggest trying, excuse me, the first three. They're a little bit more simple and not extensive recovery. Another thing that I want to go over with you is um, also just a few tips, give you just a few tips to kind of help you manage skin cancer. There are many people that are diagnosed with this squamous cell carcinoma, and like I said, they usually have, if it's caught in the early stages, we can definitely, you'll definitely have a increase in the cure rate. Um, but it is important that you continue to come to your follow-up appointments, and it's also important to do perform skin self exams. So if you see anything to where your skin, if the skin is growing or if it's bleeding or changing, you want to immediately contact our office. There are some other things that you kind of want to avoid, and that is uh, your exposure to the sun. And what I mean by that is it's okay. I'm not telling you not to go outdoors or anything like that, but there are certain times that you want to avoid. Um, and that would be like the peak hours from 10 a.m. to 2 p.m. You kind of want to avoid, you don't want to be in the sun as much, um, because that is when the sun, your skin it can be very exposed to that sun. Also, you want to avoid indoor tanning. Uh, you want to also use sunscreen on every part of your body. Apply sunscreen and lip balm to dry skin 15 minutes before going outside. Um, and those are just a few things that you want to do to kind of help manage the skin cancers. If do you have any other questions for me today? Well, definitely want you to talk with our front desk to go ahead and get an appointment. So we can go ahead and start if you wanted to kind of look over your options, your treatment options. Like I said, the chemotherapy queen right now is going to be one of the things that I suggest that you try because it is more, like I said, a simple treatment. And if that doesn't happen to work for you, we'll give it at least we'll say about a month or two. If you don't see any results, then we can definitely go in and try other treatment options. Okay? All right. Okay, well, you take care. Thank you.